Hi, everyone. This is Marcus Grimm with Medtrics, and I'm joined with Santhosh Cherian, CEO of Medtrics, to talk about even more features inside the popular Optimizer feature. Just for the people who are watching this particular video who don't know what Optimizer is, you get a lot of compliments about it. What does Optimizer do?
The Schedule Optimizer in Medtrics is something that we started developing 3-4 years ago to figure out a way to automatically generate clinical schedules for veterinary students and medical students. The way that it works is we take in all of the curricular requirements, what's the mandatory course, how many electives they have to do, and all of the student preferences, where do they want to do certain rotations, and then the capacity at each hospital and clinic. And then we automatically generate a schedule for the school that maximizes the student preferences.
We're always trying to make sure all of these students graduate on time, but it doesn't take much for one little flaw in the schedule to actually disrupt that, right? So if it happens and a schedule gets disrupted, it's a pretty big deal, right?
Exactly. Administrators are working overtime to make sure the schedules are perfect. And a lot of times they don't make mistakes because they spend so much time. But you can also factor in student happiness. They're trying to pick experiences that will give them a chance of being a certain type of veterinarian. If you don't give them that experience, it could hurt the chances of them ending up with the career that they want. Same thing with medical students. And more importantly, the Optimizer goes through millions and millions of scenarios to create the optimum schedule. That's not humanly possible to do that. It always finds the most optimum schedule for your school.
And now we're going to talk about the new feature. It does that assuming all the information that goes in there has been formatted properly and we have it on time and we've gotten it from everybody. So I love the fact that now your team is saying, okay, so how can we make sure that we're getting all that data in a standard format? Tell me about the new feature.
Yeah, so the new feature we've added to the Optimizer is site capacity collection. Imagine you have a medical school or a veterinary school and you have partnership with 20 different hospitals. Each of those hospitals have to tell you how many students they can accept for each block. So let's say you have a surgery rotation. They can say, we can accept 5 students from your school for your first block, 4 students for the second block. We're not going to accept any students for the third block. All this information needs to be collected, organized into a certain format for our Optimizer to understand it. Traditionally, schools have been using various methods, whether it's a smart sheet or a Google form, to collect this from different hospitals and input that so that we can have it for optimization. Now we've streamlined this. We built a new functionality in partnership with Lincoln Memorial University, where they have hundreds of these sites across the country. What we did was we built an interface in Medtrics where the schools can set up all of their criteria for the optimization and then give access to each coordinator at a hospital. And that coordinator can go in there and fill in what their capacities are. You can say, block 1, we're not accepting students. Block 2, we're going to accept minimum of X students and a maximum of Y students. So we collect all this into one interface, and the administrators simply log in, plug in these values, and we have everything we need to optimize. We simply export that data in the exact format that we collected and run the Optimizer.
Because you know where all that data is and it's been imported into the system, you sort of know, okay, when do we have all the data in here? Now's the time to run the Optimizer, because I'm sure when you're getting information from sites too late in the process, your team probably needs to run the Optimizer again, right? So it's all you're really doing is you're setting up that data to be structured, and when you go to actually run that Optimizer, you know it's going to be a good run, right?
Exactly. That's real-time visibility into what's been completed and what's not. When you are looking at this interface, it also allows the schools to support the coordinators at these hospitals in a better way. For example, if they're stuck somewhere, they can assist them in making sure that they collect the information in a timely manner. And then this information is also used in the next phase. After you collect the capacity, the students have to go into the system and enter their preferences and the ranking. In the past, you had to take this capacity information that was collected on some other form, format it, import it into the platform so that students can enter their preferences. Now, you simply collect it, verify it, activate the student portion of it. They can just rank the list, and then we get that information collected and ready for optimization.
This feature, it's shipped, it's out, it's available, correct?
Yeah, it is. And it has been handed out to our clients. All of them have access to it. They're eliminating whatever manual process they were using to collect this capacity information.
The site capacity feature, is that a standard feature if I'm buying Optimizer from Medtrics?
Yeah, it is part of the optimization. We have upgraded everything to schedule optimization because it's a better outcome for the students. Lottery uses randomized schedules, which is not ideal. It doesn't look for the optimum schedule. It just looks for a schedule. We want to make sure that we're generating the best schedule possible for the students.
Site capacity planning, now a feature added to the Optimizer feature with Medtrics. It's a great one. Tosh, thanks for joining us today. For Medtrics, I'm Marcus Grimm.